All right. Good evening, ladies and gentlemen, all of my nursing assistant students. Um, I am happy to have you here. For some reason, my video is not showing, but that's okay. Edit. Okay, let's put my video back on. There you go. All right. So everybody's going to be muted, and I will let you guys in as I do the teaching. Okay? So, again, open your book to chapter 1, guys. Open your book to chapter 1. Okay? And let's get started. Okay? Um, we are live on the Zoom, and I want to thank you for coming out. And we are also live on YouTube, and we are using the Nursing Assistant Care, the basic book. Okay. So if anybody missed this class, they can always go back, and I will not, and go back on YouTube so I don't have to repeat the class and whatnot. Okay. Okay. The nursing assistant in long term care. The nursing assistant mostly would work in a long term care facility. What is a long term care facility? Long term care facility is basically a place where patients go to receive care. And most of the time, the long term care facility is known as the nursing home. Okay. So, in the long term care facility, the patient can receive uh, different kinds of health care. They can receive care from the nurse, the doctor, medication, etc. We call that skilled care. Skilled care, care that is medically necessary. Patients may be in there for different length of stay. They may be in there for weeks, months, years, or until they die. But in the nursing home, patients do get discharged. Sometimes they have what we call a terminal illness. Okay, a terminal illness is an illness that oftentimes people would die from. Okay, terminal illness is an illness that your patient would most likely die from. Some people are in the long term care because they have a chronic illness. And chronic illness is a long term illness, and it's often diagnosed by a doctor. Only the doctor has the a doctor can diagnose a disease after they did all kinds of tests. They can diagnose a disease. Okay. Now, there are different types of healthcare facilities. We have nursing home. We already talked about that. Patients often receive care from home care, right? If you go on page 2, you have home health care. People receive care at home. Assisted living, right? These are the kind of people that they can do something for themselves, but they do need more help, right? A lot of people would get would receive more help. They trying not to end up in a nursing home. There's adult daycare, day services. That's kind of like a daycare for adults. Acute care, we talked about that. That's hospital. Subacute can be nursing home, or it can also be in a hospital. We would call that a step down unit. There's outpatient, rehab, and hospice. Hospice is for people who have less than 6 months to live. So all these different healthcare facilities, the nursing assistant can get a job and can provide patient care. The kind of care that we would provide is called activities of daily living. Okay. Now, sometimes we call it ADL care, but it's actually, you know, basic nursing care. Go to page 4. On page 4, ADL care, activities of daily living, we have bathing, page 4, helping with elimination, range of motion, transferring, a vital sign, meals, dressing, back rub, mouth care, changing beds, cleaning the environment for the patient, keeping it clean, all that kind of stuff. Okay. So now we know what the nursing assistant's job is: bathing, dressing, elimination, all the ADL care. Okay. It's very important for the nursing assistant to document. Document means that you are charting, you are writing in the medical record what you did for the patient. Okay. You're writing in the medical record everything that you did for the patient. Okay. So it's very important that the CNA document. If you don't document, they say you did not do it. And your documentation is important to everyone that's providing care to the resident. Okay. Now, the patient receives care from a team. We call it the healthcare team. On page 5, you can see we have CNA, the nursing assistant, we got the nurse, the registered nurse, we have the LPNs. All of them are providing care. We have the advanced practice nurse, we have the doctors, the physician, physician assistant, physical therapy, occupational therapy. All of these people have their job, they have their responsibilities. They are professionals, they went to school, they received years of education so they can provide the different types of care to the resident. If you go to page 6, on page 6, you will see part of the care team. We have what we call speech pathologist, that's speech therapy, dietitian, right? Social worker, activity director, right? So the team that's providing care to the patient is very big. Okay, it's a lot of people. The patient himself is part of that team. Okay, the patient and their family. Okay, everyone in the team work for the nurse, works for the patient. I'm sorry, they all work for the patient. We all focus on what is important to the patient, right? On what is important for the patient, what's important to the patient. Okay. Now, um, so the patient is the boss in the group, in the care team. Basically, what I can tell you is that the patient is the most important member of the care team. Right, the patient is the most important member of the care team. It's all about the patient. The family is important to the care team. Why? Because um, when the family is there, patient receives better care. The family can advocate, the family can fight for the patient. Okay? Everyone in that team, they meet, they talk about the patient, and they create what we call the healthcare plan on page 7. They create the care plan. The care plan is the plan of care on how they're going to take care of the patient. So the nursing assistant, the nurse, the doctor, the dietitian, everybody needs to know what the care plan is. Okay. And in the care team, we have what we call leaders. We have a ladder of leadership, a chain of command. We call that hierarchy of leadership. Okay. In the team, everyone is responsible for the patient. We call that liability. You are legally responsible for the patient. And because you are responsible, page 7, you need to do only what you are trained and licensed to do. We call that your scope of practice. Practice only what they train you to do. Okay. On page 8, everyone that's in the team, CNA or nurses, they must follow policies and procedures. Policies is what we do, a course of action that should be taken every time a situation happens. And the procedure is the method, how we're going to do it, the way things get done. Okay. So I guess you can call the policy procedure the rules of patient care or of the healthcare facilities, right? So every healthcare facility says you must respect patient confidentiality, right? We talked about that already. Follow the care plan. um Understand and follow your job description as a CNA, right? Everybody in that team must respect patient privacy, must respect patient confidentiality, must respect patient right and protect patient right. We're on page 8. Everyone in that team must act and behave and talk like a professional, okay? And to be professional, to have professionalism, to show professionalism. Page 8, the professional, you must have professional relationship with your resident. You must provide person-centered care. That means take care of the patient the way the patient wants you to take care of them. Okay? Keep a positive attitude. Maintain confidentiality, respect privacy, be polite. Don't discuss your personal problem with the patient. You can't be using your cell phone in the patient's room. Don't use profanity. Pay attention to the resident. Don't give money and don't accept money or gifts from the patient. Tell the patient, explain the care that you're going to do, right? Complete your task efficiently. Follow practice like hand washing. Follow infection control. All of that is very important. If you're a professional, page 9, you take direction, you take feedback without getting upset. You come to work clean, you come to work on time, right? You have to be compassionate. Compassionate means that you're caring, you're concerned, you show empathy. Empathy means that are you can identify with the person feeling. Okay. You show sympathy. Sympathy means that you share the feeling and the difficulty of the patient. That means if the patient wants to talk to you about their problem, listen to them. Okay. Be honest, tactful, conscientious, dependable. We could spend a whole night talking about chapter 1, how you should be as a CNA, but I think it's better that you take some time also to do the reading. Page 10, be patient, take your time with the resident. Don't rush them, be respectful, be unprejudiced. Don't show you like one better than the other. Be proactive, right? Um, they also talk about behavior, ethical behavior. I think that means that you need to remember as a CNA that the government, the law is involved, and also there's your conscience. Do things with good conscience. So the guidelines for the guidelines for ethical behavior, page 10. Remember, every time you see the word guidelines, that means you got to go back and read that. Be honest, protect privacy and confidentiality, keep staff information confidential, report abuse, follow the care plan, do not perform tasks outside of your scope of practice. That means don't do things that you're not supposed to do. You're a CNA, only do CNA work. Don't accept gift or money. document the right way, report observation, etc. Right? In 1987, we're on page one, page 11. In 1987, the government creates a law called Omnibus Budget Reconciliation Act. This law says that the CNA must be educated, must have 75 hours of education, 12 hours of in service every year. The CNA must renew his or her license every 2 years. So remember, guys, your CNA license, you need to renew that every 2 years. You have to renew your CNA license every 2 years. Okay, you must have 75 hours of initial training and 12 hours of annual
I have a question.
annual training. Okay, please hold on to the questions, and I will take them at the end of this chapter before I go on to chapter 2. Okay, all right. Okay. So this law called OBRA, Omnibus Budget Reconciliation Act, they say they outline the patient residents' rights. Okay. They outlines residents' rights, like for example, patient has right to good quality of life. They have right to highest level of wellness. They have right to be informed. Patient have right to participate in their own care. They have the right to informed consent. That means you must inform them and give them a chance to consent or disagree or refuse. That also means your patient has right your patient has right to refuse. Okay, your resident has right to refuse the care. Okay, your patient has right to make independent choices. Your patient has right to privacy, to confidentiality. Okay, you must remember that your resident has right to dignity, respect, and freedom, right? So as you watch this lecture, just remember you need to go back and read the chapter, because this is not a reading session of the chapter. Remember that. Okay? I'm just doing a quick overview of the chapter. Your patient has the right to security of possession. That means you cannot steal from the resident. Okay? There's right to complain. If your patient begins to complain about the care that they are receiving, well, you need to take that into consideration and respect what the patient has to say. Have the patient has the right to have visitors, right? You cannot chase away the resident's visitor because they're making noise. You can't do that. We got to respect their rights. Page 13. Now let's take a quick look here. Never abuse guideline. Anytime you see the word guideline, that means let's pay attention. Okay? Guideline. Protecting residents' rights. Never abuse a resident physically, emotionally, psychologically, verbally, sexually. Call the resident by their preferred name. Involve the patient in planning their care. Allow the patient to make choices. Don't expose the resident unnecessarily. Explain the procedure. Be truthful. Respect patient refusal of care. All right. So again, take some time to go through this, because anytime you see guideline, that means questions will come from it. Page 14. Do not accept gifts or money. They keep saying that. Why? Because if the patient forgets that they gave you the money, they can accuse you. Okay? Um, they can accuse you. And if they accuse you, then guess what? You are in trouble, because they said, well, if the patient says, you stole my $20, okay? If the patient says you stole my $20, basically, if the money's in your pocket, you got very weak, very poor defense. Okay, so let's talk a little bit about abuse. Page 14. Abuse is mistreatment of the patient. If you're mistreating the patient, you are committing what we call abuse. Okay? Now, the abuse can be physical abuse, any mistreatment that causes harm to the body. There's psychological. Again, this one would cause harm to the mind. Emotional harm, okay? Like threatening, scaring, humiliating, hurting a patient, intimidating, making the patient afraid, insulting, right? There's a verbal abuse. Verbal abuse, that means to verbal abuse, that means to use bad words to the patient. There's sexual, financial abuse, um, assault, a use of threat of harm, okay, assault, battery, there's domestic violence, and a whole list of things that can happen to the patient. Be careful while you're providing patient care not to commit what we call sexual harassment, okay, and sexual abuse. So, for example, if the patient says, I will wash my own private part, let them, okay? And if your patient often accuses people, get someone to go in there with you as a witness, okay? So that way you are in the clear, okay? Neglect is not doing for the patient what you are supposed to do. We call negligence, or we call it negligence or malpractice, especially when you're a CNA, you're a licensed professional. Okay. So now the nursing assistant has to remember that not every patient can complain. No, the nursing assistant needs to remember that their job is to observe and report any sign of abuse. Page 15. Poisoning, traumatic injury, teeth mark, belt mark, bruise, scars, fractures, burns, right? Scalding burns, swelling in the face, anything that can be a sign of abuse. Read the whole thing when you get a chance. You must report that, okay? Because now your patient is afraid to talk for themselves. Go on to page 16. Mood change, pressure injury, unclean body, body lice, unanswered call lights. CNA, you must report that. Your job is to rescue, to defend the patient. Dehydration, must report that. Now, the law, the same law, the Omnibus Budget Reconciliation Act, also assigned a person to the job. We call that person ombudsman. Ombudsman, page 16. Ombudsman is the person who has the job of fighting for the patient. So if your patient complain about you, the ombudsman will do all kinds of investigation, will report to the police, will report to private investigators, will report to the courts, and they will fight until justice is served. Okay? So keep that in mind. Page 17. Confidentiality means keeping patient information private. In 1996, the government created a law called HIPAA, Health Insurance Portability and Accountability Act. That law says patient information is private, protected health information. That's what we call it. So, how do we maintain confidentiality? How do we protect our patients' privacy? Page 17, guideline. Make sure you're in a private area when talking, when listening to or read messages. Know who you're talking to on the phone, right? Do not talk about your resident in public. Use confidential rooms, all right? You do not bring families or friends to work, right? So basically, anything you know about your patient, you can't tell people. You can't tell the patient's neighbor, all right? If you have patient information on your phone, you must put that phone on, you must lock that phone, right? You must lock that phone, put a code on it. Do not leave documents where people can read it. So if you have patient vital sign on a piece of paper, you cannot leave that piece of paper somewhere where people can see it, because that vital sign is private, is protected health information. Okay, so our job is to document on our resident. Okay, once you see something, you report it, but you must also document. Document means to write it down. Page 18. Document care immediately after it is given. Okay, think about what you want to document before you document. Use facts, not opinion. Okay. Many facilities have different ways for you to document. Okay. But you must document with pen, black pen. You must sign your documentation. Put your full name, page 19, and title. Right. You sign your full name and title. Okay. So sometimes people do a little scribble, but no, you must sign, write your name. Okay. Documentation needs to be done using the 24-hour clock, right? So you must put the time in. Sometimes we document using conventional time, 1 o'clock, 2 p.m., 1 a.m., 2 p.m., 7 p.m., and other times we document using military time. Military time means we use 0 100 hours, 800 hours, 1,200 hours, 1,300 hours, etc. Right now, um, we must go to page 20. We must report and document any kind of incident. Incident means an accident or problem or unexpected event. Most common incident, excuse me, patient fall, page 20. It must be reported. It must be documented. If your resident breaks something or damage something, if you break something or the resident breaks something, if you make a mistake, you have to report it. Resident and family member asking you to do something that's not legal, you have to report it. There's guideline on reporting incident. Please take some time to go over it. All right. So this is the end of chapter 1. We're gonna take a couple of questions and then we're gonna go into chapter 3. Thank you so much. So not chapter 2. So sorry. Okay. Let me unmute everybody. And I see someone named Class had a question. Unmute. Now, someone had a question.
Yes,
Mm-hmm.
you go too fast.
Okay. Now,
That's the question.
I appreciate your comment if you call that a question, but that's not really a question. That's a comment. Um,
Okay.
that's okay. I'm sorry I have to go fast. As you can see, my voice is not very good. Plus, we are behind. We are a little bit behind, and I'm trying to catch up. So, this is also on YouTube. Okay, I'm recording this session on YouTube so you guys can go back and watch. So every time I do a chapter, we're gonna put it on YouTube. So on this live, on this um, Zoom, we will do it only in English, but you guys know that on Saturdays you will have the other side, right? You will have it in clear. Okay? So I
Okay.
can help you. So
I have a question.
go ahead, darling.
So you said if the patient has any bruises or whatsoever, to report it. What if the person before, let's say that that person had 7 to 3, and then it's your turn to start your shift. And
Mm-hmm.
then before starting, that patient has bruises, but that other person did not report that. And once you go, you get blamed for it.
Mm-hmm.
What should you do in that particular position? Like what do you do? Because you can go with your phone and you don't really have anybody that witnessed what
Mm-hmm.
happened.
Mm-hmm.
So what do you do?
So basically, you're saying that you find bruises,
Yes,
and
but
then
the person that was doing the shift before you
mhm,
did not report
did
the
not report
incident.
it. Okay.
Mm-hmm.
So basically, as soon as you find a bruise or anything that we call a reportable, you go get the nurse. You say, "Nurse, I need you to come see this. I just found this." Okay?
Okay.
If you
Mm-hmm.
report that right away, now when they do the investigation, you are in the clear.
Okay.
But if you don't report it, you become a suspect, just like the person before you that did not report it.
Okay.
Okay?
Mm-hmm.
I know reporting an incident is something that nursing assistants don't like to do because they think they're going to get in trouble, but you will get in more trouble if you don't report it. And it's not really about getting in trouble, it's about protecting the patient. Okay?
Okay.
If I'm taking care of your mother and she has a fall, you would want me to report that, right?
Mm-hmm.
So we can take good care of that problem. But if I don't report it and she has a broken hip, then we got a serious problem.
Okay.
Okay? Very
Okay.
good.
Thank you.
You're welcome. Any more questions before I go to chapter 2? Okay. Let us go into chapter 2. Okay. Now, somebody just said, I'm going too fast. I try not to read the comments. Uh,
There's
the
a question in the chat,
the question is what?
but the person deleted it.
Oh, okay, that's fine.
I have a
Okay,
question, teacher.
go ahead.
Okay. If the patient refuse everything what to do with the patient, what what
So, if the patient refuse care,
yes, refuse care.
well, your job as a nursing assistant, if you go see the patient at 8 o'clock, patient says, I don't want to do anything.
Mm-hmm.
You leave the patient alone, you go do another patient. Maybe they're not ready, right? And then you come back in 15, 20 minutes. If the patient is still not ready, you go do another patient. But you have to talk to the patient and say to the patient, okay, you know what? I'll try with you again later. Is that okay? Patient
Mm-hmm.
says, okay, whatever, try later. After a third time, patient said no, you say, okay, I will report that to the nurse, and the nurse will talk to the patient. But the point is, you have to talk to the nurse. You have to let the nurse know. Okay?
Okay.
The nurse
Thank
needs to
you.
know what's going on. Okay, very good. Thank you so much for that question. Okay, we have time for one more question before we go into chapter 2. Nope. Okay. I'm going to mute this again so we can cover chapter 2. Okay. Again, remember this is going to be on YouTube, and I appreciate the fact that I have 98 people on the Zoom right now. I'm very happy with that. That tells me that you guys are winners. You guys are gonna make it. I believe in you. Okay. I am so proud of you. It was 100. Yes, I know, right, Svakia? It was 100. A couple of people, I don't know. Maybe they fell asleep. Somebody said, they was tired. Okay. So I will try to speak slowly. Okay, Bernadette, I will try to speak slowly. Okay. Okay. Foundation of resident care. Okay. Now, to provide good care to your patient, to your resident, there must be what we call communication. So that means there must be talking back and forth between you and the resident. Communication is the process of exchanging information with the patient. So there's verbal communication, what you say and what you write. If you say it, it's verbal. If you write it, it's verbal. There's also nonverbal communication. Nonverbal communication is basically things that you say without using words. Page 21. So we're looking at body language, okay? Attitude, behavior, the look on your face, right? If you come to the patient and say, "Can I help you?" That's saying, "Yes, I want to help you." But if you go to the patient and you say, "Can I help you?" Mm, that basically says you really don't want to help. I really don't want to help. Leave me alone. Okay? So you have to look at your body language. Okay? And you really need to communicate anything that can be a problem for the patient. For example, on page 21, falls, chest pain, headache, trouble breathing, abnormal vital signs, change in mental status. Go to page 22. Fever, loss of consciousness, bleeding, swelling, etc. Right? So, communication, you use that to give report, okay? To give report. So, page 22, proper communication. Always greet the resident by their preferred name. Identify yourself. Focus on the topic to be discussed. We're on page 22, right? Face the resident when speaking. Talk with the resident, not with other staff about the resident, etc. Right? Now, in order for you to communicate effectively, you have to collect information. Page 22, you see objective information. Objective information is what you see, hear, touch, or smell. So that is part of your observation. If you can see something, if you can hear something, if you can touch or smell, that's all observation. That's all observation that we now call objective information. Subjective information is what the patient says. Okay? You can call it objective information, something you did not see, you did not observe, but the patient said. Patient says, "I'm hungry." Subjective. Patient says, "I'm tired." Subjective. Patient says, "I have pain." Subjective. But you see the patient crying. Objective. You see the patient on the floor. Objective. Right? You see tears. Objective. You see a red or swollen body part. Objective information. Okay? So you use for objective, you use your sight, you use your sense of smell, touch, and you use your hearing. Right? Okay, so let us go to page 24. Okay, so communication can also be done in writing as part of your verbal, right? Verbal communication. So we have what we call the nursing language or healthcare language, where they have prefixes, suffixes. In the back of your book, you will see a bunch of abbreviation that I would like for you to go back and take a look at them. Okay, I'm not saying study, but take a look at them. Okay, now let's get back into the in the room with the patient. Okay, now we have to communicate effectively with the patient. Effective communication basically means identify us. Effective communication over the phone, actually, you have to identify your facility name, your position. Okay, if you need to find the person, the person that the caller wishes to speak to, place them on hold, etc. Right? Now, effective communication, um, you have to make sure you get to effective communication with your resident. For example, we have here what it's called barriers to communication. Okay, barriers to communication are things that cause the communication between you and the patient not to be very good. So, for example, if the patient on page 25, patient does not hear you or you don't hear the resident, difficulty to understand the resident use words or the nursing assistant use words that neither one can understand. If you use profanity, cliche, respond with why, give advice, right? If you speak a different language, right, like most of you do, it's gonna be a little problem. So basically, you want to work on that. Raise your voice. Good morning. My name is Gene. I'm your CNA today. Okay. Make sure the patient can understand what you are saying. Okay. All right. Now, communication is very important. It's very important. Go to page 26. Remember, when you're dealing with your resident, you have what we call when you're dealing with residents, when you're dealing with different people um, of different culture, remember you have what we call um, there's difference in tradition, difference in what they what they understand, what they think. So culture can affect communication. Remember that. Culture can affect communication. Okay. So basically, keep in mind that you may have people of different culture, and just like you have a different culture, and you need to understand that, you need to respect that, right? And respect the difference in the culture. In some culture, when people talk, well, it's like they have to be very close. In other culture, people like to have their personal space. They don't want you to be all up in their face in some different cultures, in certain cultures. Okay, so respect the difference in the culture. All right. Keep in mind when you're communicating with your resident, they may have problems, what we call impairment, a loss of function. If your resident has a hearing problem, right? Page 26, we call it hearing impairment. Okay. How do I deal with this patient? Page 26, guideline. Make sure that the person is wearing their hearing aid and that is it is turned on. All right. Reduce background noise. Get the resident attention before speaking. Speak clearly, slowly, and in good lighting. Directly face the resident. Do not shout. Page 27. Do not shout or mouth the word in an exaggerated way. Keep the pitch of your voice low, right? Resident may use lip reading. Okay, there's a whole list of things that you can do when you're communicating with a patient that has hearing problem. If you have a resident with vision problem, vision impairment, the patient that has difficulty with their eyes, so hearing, vision, page 27 guideline, encourage the resident to use eyeglasses or contact, right? Make sure the eyeglasses are clean. Contact lenses are made from different types of plastic. So, know that you need to take special care. Not knock on the door, identify yourself, make sure there's proper lighting in the room, face the resident when speaking to the room. When you enter a new room with a resident, orient them to where things are, etc. Right? Go to page 28. On page 28, okay, use the face of an imaginary clock as the guide. Okay. Do not move personal item in the rooms. Leave the call light within reach. Leave the door completely open or completely closed, depending on what the patient wants, etc. Right? So that's how you communicate and interact with your patient that has a hearing problem, that has vision problem. Okay. You may have patients with mental disorder. We are on page 28. Page 28. Patient with mental health. Okay. Now, when the mind is healthy, the patient, anybody can get along well. They adapt to change. They care for themselves. They can give and accept love. But when there's a mental illness, right? When there's mental health disorder, then the function of the brain is affected. Logic, memory, reason, orientation is all out of the window. Your patient may be confused, disoriented, agitated, anxiety, page 9. People who have mental health disorder cannot simply choose to be well. Okay? So sometimes they cannot control their emotion. All right? So keep that in mind. So how do I communicate with a patient that has mental health problem? Do not talk to adult as if they're children, right? Use simple and clear statement. Lower to your tone in a normal tone of voice. You make sure what you say and how you say it show respect and concern. Be honest, be direct, avoid argument, maintain eye contact. Okay. Now, your patient with mental health problem, at some point, page 29, they become combative. Okay. They want to fight. They are ready to fight. Combative means the patient is violent and the patient is hostile. I want to remind you that we are recording this on YouTube. You can go back and watch this version or previous versions we have. Okay. So combative patient is kicking, hitting, punching, etc. Right? Verbal attacks. Guideline. How do I communicate with a combative patient? Block physical blows. Step out of the way. Do not hit your patient back. That would be called abuse. Allow the resident time to calm down. Ensure the resident is safe and give space. Remain calm, be flexible, stay neutral. All right. Go to page 30. Do not use gestures that could frighten or startle or threaten the resident. Okay. If your patient has mental health issues, if they have mental illness, your patient may become very angry. Page 30. Okay, they have very not they're very angry, they're very upset, right? So how should a nursing assistant deal with a patient that is very angry and that also has mental problem? Stay calm, do not argue with the patient, empathize, show you understand, Try to understand how the person is feeling. Treat the resident with dignity. Find out what's the cause of the anger. Answer call light. Stay at a safe distance, etc. Right? Okay. So if your patient has inappropriate behavior, right, you can be strict and firm, but you are not there to yell at the resident or hit them. Okay. And you can say to the resident, no, you do not behave that way. Okay. I will report this to the nurse. Okay. Okay. Now let's talk about patient safety. Let's talk about ways to promote safety. Page 31. Let's go to page 31. Okay. Safety is very important to our resident, and it's also very important to us as healthcare workers. Okay. We are responsible for safety in the facility. Okay. Safety for ourselves, safety for the patient, safety for each other. So because of safety, we leave the call light in the patient's hands. Because of safety, we lock the bed. Okay. We leave the bed down. We clean up the room. We make sure there's no water on the floor for the patient to trip and fall. Okay. So because of safety, you do what we call rounds. You check, you knock on the patient's door every 30 minutes, every hour, and you check on the patient, make sure that your resident is safe. Okay. Now, for your safety, you can get hurt as a CNA. So you have to use what we call proper body mechanic, page 31. Proper body mechanic is the way the part of the body work together when we move. You have to maintain good alignment, right? The body should be in good alignment, in good posture. Okay. You have to have strong base of support. So your feet, you open your feet to give you some support. Okay. So let's look at the guideline for using proper body mechanic. Okay. Because that's very important to you guys. Okay. Future CNAs. To tell you the truth, guys, I am really, you know, I'm really happy to be doing this job because when I take you guys to clinical and I see that you are making a difference in the life of the patient, when I work on the floor and I see the CNAs doing positive things, doing great things for the patient, I'm really happy with that. And I'm really happy to know that I am bringing more nursing assistants into the field. Okay. So make sure you study so you know your stuff. Okay. Guideline for using proper body mechanics. Assess the situation first, right? Clear the path. Use both arms and hand to lift. All right. When lifting a heavy object from the floor, spread your feet shoulder width apart. Bend your knees. Use the strong, large muscles in your thigh, upper arm, and shoulders. Let's go on to the next page. Hold page 32. Page 32. Okay. Hold the object close to you when you are lifting. Push and or slide objects rather than lifting. Avoid bending and reaching as much as possible. If you're making a bed, adjust the height, right? Raise the bed up to a safe working level. When task requires bending, use good stands and bend with your knees and lower yourself to a squat position. Do not twist when moving. Okay, instead turn. Okay, do slight little walk to turn. Get help from coworker. Talk to the resident before moving them. Never try to catch a falling resident. We are on page 32. Report to the nurse any task that you cannot safely perform. Okay, never try to lift an object that you feel you cannot handle. Okay, so as nursing assistant on page 32, we need to know that fall is the most common accident that happens in the nursing home. And part of our job is to prevent fall. Fall causes fracture. Fracture means broken bones. Okay, so your job is to go into the patient's room, check to make sure that the environment is safe, the floor is safe, the patient is not going to fall, call light is in reach, bed is not too high, bed is low, bed is locked, floor is not wet. Guideline, page 33. Clear all walkway of clutters, trash, throw rugs. All rugs should have non-slip backing. Have the resident wear non-skid shoes. Do not wear clothing that is too long or drag on the floor. Keep items that are used often closed to the resident. Answer call light. Immediately clean up spill. Report loose handrail. Mark uneven flooring. Improve lighting. Lock the wheels. Lock the bed. After completing care, return bed to the lowest position. All of this is on page 33. Guidelines. Anytime you see guidelines, you must study. You must study. Offer help with elimination. Take your patient to the bathroom. Knock before you enter. You are at risk of falling. Okay. Know the resident that, sorry, I'm sorry. Know which resident are at risk of fall so you can check up on them. All right. There's also the risk of burns. Okay. Burns. Scalds means burn caused by hot liquid. We give you our patient hot coffee, hot tea, hot bath, etc. Right. So preventing burns guidelines. Check the temperature of the water. Report frayed cord to the nurse. Right. Do not use them. Remove them from the room. Let the resident know where when you are to ready to pour hot liquid. All right. Let me let this person in. Okay. Make sure residents are sitting down before serving hot drink. Right. Um, so be careful. Check the temperature of the water in the shower before you put it on the patient's skin to prevent burns. Page 34. Identify your resident. Remember beginning procedure steps. Identify the resident. Can you please tell me your name? Can I take a look at your ID band? That's very important because some patients will walk into another patient's room. And when they do that, you can get confused and do something for this person that's not the patient you want to do it for. Okay, so you check the ID band even if you enter. Okay, page 34. This room is for Marlene Atkinson, but guess what? You can have patient named John Smith walk into this room and lay down on that bed, or patient named Marie or Maria or Mary or Elizabeth go lay down in that bed. So you want to check the ID band. You want to ask for the for name. There's a risk for choking, so you have to sit your patient upright when you're feeding them. Feed your patient slowly. Okay, if your patient has swallowing problem, you want to place the food on the strong side of the mouth. If your patient is choke has had a stroke and one side is weak. All right. The risk of poisoning is there. So anything that is harmful like Clorox, bleach, etc., you want to make sure that you lock these things away from the patient. The gallon of milk is white. The gallon of Clorox is also white. So your mentally ill patient could say, "Hey, maybe that's milk." They don't know, right? Mental illness. Okay. Risk for cuts and abrasions. Now, when you're changing your patient position in the bed, you have to lift and turn, right? You can't just drag your patient's body on the bed. That would cause abrasion. So that would basically scrape the skin. Also, make sure that your patient is not falling. Prevent fall, because when they fall and their body slides on the mattress, on the carpet, or on the floor, it can cause, skin problem. It can cause cuts and abrasions. Okay. when you're checking your residence room, you're also preventing the risk of fire. Guidelines, okay? Wait a minute, why do we have to prevent the risk of fire? Well, some people will smoke, some patient will forget, and they will smoke in that bed. They were smokers all their lives. They will not stop now. Okay, so when you check in the room, make sure you don't see your patient smoking. You would report that. The heater, make sure there's nothing laying on the heater that could cause fire. Okay, so guideline: reducing fire hazard in responding to fires. Some facilities are non-smoking. Resident may use so if residents smoke, okay, make sure that they are in the proper area for smoking. Resident may use electric cigarette. Again, make sure they get adequate supervision. Report frayed cord or damaged electrical cord. Fire alarm or exit doors should not be blocked. Okay. Every facility have fire extinguishers. Remember, for your state exam, page 35, you're going to need to remember what PASS stands for. When you're using the fire extinguisher, pull the pin, aim at the base of the fire when spraying, squeeze the handle, squeeze back and forth at the base of the fire. If you want a real good illustration, what you should do is go on YouTube and type fire extinguisher PASS, and you would be surprised that you have thousands of videos that you can use to educate yourself. Okay, in case of fire, the RACE acronym is a good rule to follow. R, remove anyone from danger. On your exam, it could say ensure safety. It could say remove patient out of get patient out of the room. Okay. um Alert by activating the fire alarm or calling 911. All right. Contain the fire, basically closing the door where the fire is. Extinguishing the fire using the PASS method if the fire is in your way. If the fire is not in your way, use E to evacuate. Get out of there. Okay. Each facility has fire evacuation plans, so you need to know that. Stay calm, don't panic, okay? And know where your residents are. Go to page 36. Residents can walk. Who can walk will also need help getting out of the building, okay? Those with hearing impairment, right? So when there's a fire, we got a real mess to deal with. Remove anything blocking windows or doors, right? Do not get into an elevator during the fire unless directed to do so by a fire department. Stay close to a room. Stay low in a room to escape a fire. All right. So you have the whole guideline there. Okay. Now we're gonna skip the safety data sheet and the disaster guideline. I'll let you guys do some reading on those. We're gonna go to recognizing medical emergency. That's the next step. Medical emergencies may result from accident or sudden illness. Anytime you're taking care of sick people, okay, anytime you're taking care of residents or patients, know that anything that can go wrong, right? So your patient with heart disease can develop a heart attack and die on you. Your patient with, you know, high blood pressure can have a stroke. Your patient with diabetes can have a stroke. Anything can go wrong. You can walk into a room and find the patient on the floor or dead, etc. Right? So these steps, page 37, these steps show the correct response to emergencies. Assess the situation. Don't just run to the situation. Assess it. Make sure you take a look at what's going on. Make sure you're not in danger and patient is not in danger before you approach. Assess the victim. Check if the victim is okay. Are you okay? Are you okay? All right. Check the victim for severe bleeding, changing consciousness, irregular breathing, pain, anything. Okay. Now, during your class, you're gonna learn to do CPR and first aid, right? First aid is an emergency care given immediately to an injured person. Okay, and CPR, cardiopulmonary resuscitation, refers to the medical procedure that that we use when the heart and lungs stop working. So you, as the nursing assistant, will become trained and certified in CPR, so that way you can administer CPR if something happens to your patient. Listen, being a CNA is serious business because we're putting the life of patients in your hand. So, page 38, quick action is necessary. CPR must be started immediately to prevent or lessen brain damage. Okay, so we will teach you CPR, and your CPR certificate needs to be renewed every 2 years. Okay. All right. Other emergencies can be choking. Choking is basically what we would call the obstructed airway. Universal sign of choking, patient is clutching at the throat. We call this clutching at the throat. So they're holding the throat, like you see on page, excuse me, like you see on page 38. Okay. We call this the universal sign of choking. If your patient cannot speak, cannot cough, cannot breathe, and you hear wheeze, that means this person is choking. Page 38, we do perform abdominal thrust. That's a method that of attempting to remove an object from the airway of someone who is choking. These thrusts work to remove the blockage upward out of the throat. Okay, so again, as you see in the picture there, right? The rescuer stands behind the patient, make a fist, put it above the navel, and will reinforce it with the other fist and bring it in and up. Okay, so again, a video will paint a clearer picture for you guys. Okay. Shock basically occurs when page 39. Shock occurs when an organ is shut down. Okay. Tissues, they do not receive adequate blood supplies. Okay. It's very dangerous. It's life threatening. The patient may die from a shock. Okay. Responding to shock, notify the nurse immediately. If you need to control bleeding, put on glove, have the person lie down and elevate their feet. Okay. If the patient is vomiting, right, or has something coming out of their mouth, put them on the left side, right, to reduce the risk of choking or aspiration. Elevate the legs, check pulse, check respiration, keep the person calm and comfortable. Maintain normal body temperature. So if the weather is cold, put a blanket, give them your jacket. Do not give the person food or liquid until ambulance picks them up and get more help. Okay, myocardial infarction is also another one. We call it a heart attack. This is basically when the muscles of the heart do not receive enough oxygen because blood vessels, go to page 40, are blocked. Okay, now symptoms of heart attack. Listen, as a nursing assistant, you are in the position of a nurse when it comes to observing and seeing what's going on with the patient. The following signs, page 40, the following are signs and symptoms of MI. MI means myocardial infarction. Okay? Myocardial infarction. It's on the previous page. That's heart attack. If your patient has sudden chest pain, sudden severe pressure in the chest, pain, discomfort in other areas of the body. If your patient complains of indigestion, heartburn, nausea, vomiting, shortness of breath, dizziness, perspiration, cold clammy skin, anything that you see is not normal, tell the nurse. Anything that you think the nurse should know, do not hesitate. Responding to myocardial infarction. Tell the nurse, notify the nurse, place the person in a comfortable position, loosen clothing around the neck, do not give the person food or liquid, monitor breathing and pulse, stay with the person until help arrive, report and document. All of that is on page 40. Well, you see, after my review here, if you don't have time to read, go back to my review. You will get a lot of good information here. Okay? Bleeding, that means we got some serious issues here. Bleeding uh can cause death quickly if we don't control the bleeding. So if we don't control the bleeding, the patient will die. Okay, so how do we control bleeding, right? Page 41. Notify the nurse, put on gloves. So don't do this without gloves, guys, because if you touch the blood and the person has a disease, has an infection like HIV, AIDS, you will get it. Okay, so wear gloves. Put on gloves quickly. Hold a thick sterile pad or clean cloth or something and apply pressure. Press down hard and directly. If you can raise the wound above the level of the heart, page 41, do it. When bleeding is under control, make sure the dressing is in place. All right. Um, so you want to put pressure on bleeding. Page 41, burns, right? So the stove can burn your patient, right? Stove, hot water in the bathroom can burn your patient. When they're ironing their clothes, they can get burned, right? um the sunburn, right? Burn on the stove, burn on the heater, anything can happen. So the nursing assistant needs to make sure that she keeps an eye on the patient. Okay, are you okay, Mr. John? Is everything okay? Checking for safety in the kitchen, checking for safety in the bathroom, safety in the patient's room, safety in the dining room, safety around the heater, anything that could cause a burn or a fire. Treating burn. Notify the nurse, page 41. Notify the nurse. Put on gloves. Use cold water, cold and clean water. Do not put ice. Do not put ice water. Okay? Do not, once the pain has eased, so do not put grease. Once the pain has eased, you may cover the area with a dry, sterile bandage. Remove and discard your glove. Don't use ointment, salves, or grease. Okay, if the burn is serious, remove the person from the source of the burn. Notify the nurse. Put on your glove. Check for breathing, pulse, and for severe bleeding. Okay. Um, do not use any type of ointment, any type of do not use any type of ointment, water, salves, or grease. Do not try to pull away any clothing from burn area because you may rip away their skin. Okay, go on to page. So everything I'm talking about here, guys, is part of what we call first aid. Okay, that is first aid. Fainting, page 42. Go to page 42. Fainting is another one. Okay, again, like I said, guys, don't forget after this class. Okay, I will see you guys in the next class, but make sure you go back and watch this class on YouTube. Okay, because I'm doing a live recording of this. Fainting means the patient passed out. There was a decreased blood flow to the brain and the patient lost consciousness. The patient becomes unconscious. Okay, so we call that syncope. Okay, responding to fainting, page 42. Tell the nurse, have the person lie down or sit down. Okay. If the person is in a sitting position, bend them forward. Loosen any clothes around any tight clothing. Stay with the person for at least 5 minutes. All right. Have the person get up slowly. All right. If the person does not faint, lower the person to the floor or the flat surfaces. etc. Right? Report and document. Insulin reaction, page 42. See, if you have a diabetic patient, you may face that. Insulin reaction or diabetic ketoacidosis. Insulin reaction, we call it hypoglycemia or low blood sugar. Either the patient had too much insulin or they did not eat enough food or they refused the food and their blood sugar just dropped. Okay? Diabetic ketoacidosis, okay? The maybe the person had too little insulin and the blood sugar just went straight up. Okay? Or maybe the person was not diagnosed or has an infection or has not been taking their medication. Symptoms for high blood pressure, high blood sugar, diabetic ketoacidosis, and symptoms for insulin reaction that we call hypoglycemia, they are very similar. Okay? Hunger, headache, rapid pulse, low blood pressure, cold clammy skin, confusion, trembling, blurred vision, right? Headache, weakness, rapid weak pulse, low blood pressure, dry skin, blood, flushed skin, drowsiness, nausea, vomiting, shortness of breath, unconsciousness. So anytime you walk into the patient's room, if the patient is not doing too well, who do we tell? The nurse. Okay? Especially your diabetic patient. Now, as a CNA, when you take a job, sometimes they want to teach you more stuff. They want to teach you how to check blood sugar. Don't say no. Say yes, because you are a future nurse. You're going into nursing. You're going into healthcare. You're going to do great things. So the more knowledge you have, the better for you. Okay? Seizure is another emergency. So many things can go wrong with your patient. Seizures are involuntary, often violent contractions of muscles. They involve a small area or the entire, they can involve a small area or the entire body. They are called seizures are caused by abnormalities in the brain. Now, how do we respond to seizure? Page 43. Note the time, put on glove, remove eyeglasses from the patient. So if they had glasses on, remove it because it's going to break. It can break and then puncture the eyes. Okay? Have someone call the nurse immediately while you stay with the patient. Remove furniture to prevent injury. Okay? Let's mute everybody again. There we go. Um, do not try to stop the seizure or do not try to hold the patient down. We on page 44. Page 44. I'm actually basically reading this to you guys. Okay? Do not try to stop the seizure or restrain the patient. Number 6, do not force anything between the patient's teeth. Do not place your hand in their mouth. That would be a big mistake that you would regret. Do not put your hand in the patient's mouth if you don't want to lose a finger. Do not give the patient food or liquid. Don't put anything in the patient's mouth. When the seizure is over, note the time. When the seizure starts, note the time because we need to know. The healthcare team needs to know. And when the seizure is over, place the patient on the left side unless the patient has any type of head, neck, or back or spinal cord injury. Okay? All right. Stroke. What is that? Stroke, cerebral vascular accident. Okay? Sometimes we call it a brain attack. It occurs when the blood supplies to a part of the brain is blocked. So the person with a stroke can have um, some symptoms that you will see. Okay? Now, for example, before the stroke happened, there's what we call the mini stroke or the TIA, transient ischemic attack. It's a warning sign that the person is going to have a stroke. The patient may have difficulty speaking, weakness on one side of the body, temporary loss of vision, and numbness or tingling. We should not ignore these symptoms. Patient says to you, I feel some tingling sensation. What do you think that is? I don't know. Let me let the nurse know. Patient says to you, you know what? For a minute there, I couldn't see anything. That's a TIA. That's a transient ischemic attack, a warning sign that a stroke is coming. Okay. Now, your patient has a stroke, may experience facial numbness, paralysis on one side of the body, page 44, right? Paralysis on one side of paralysis on one side of the body, right? Patient may have, so we call that hemiplegia, numbness or weakness on one side of the body, that's hemiparesis, slurred speech, that's expressive of aphasia, inability to talk, expressive aphasia, inability to understand, receptive aphasia, right? Use of inappropriate words, severe headache, blurred vision, ringing in the ear, redness in the face. The list of symptoms is long. So basically, what you need to remember is that anytime the patient complains of a problem, we need to tell somebody. We need, and that somebody is the nurse. The nurse will come in and do their evaluation. Go to page 45. There's something we call a FAST, FAST. This the acronym FAST can be used to remember the sudden sign of a stroke. F is for face. One side of the face goes down like this. One side of the face is droopy. The other side of the face is normal. Okay. Arm. One A is for arm. One arm is strong. The other arm is weak. The side that is affected is weak. Speech. Speech is slurred. Patient cannot speak correctly. Okay. T for time. Time to call for help. Okay. Time to call 911. Call the ambulance. Call the nurse. Okay. Patient, you may enter the room and the patient is vomiting. How do we respond to that situation? Again, notify the nurse, put on gloves, make sure the head of the bed is up or patient is turned to the side. We're on page 45. Use emesis basin under the chin, remove soiled linen. Okay. If resident is on intake and output, you should monitor that, flush and report and document. Okay, and follow infection control. Okay, now speaking of infection control, let us go to page 47. Okay, we're almost done with chapter 2. We have a few pages left, about 10 pages. That shouldn't take us too long, right? Infection prevention is a set of method that we practice in healthcare facilities to prevent and control the spread of diseases. So basically, whatever causes your patient to get sick, the bacteria or the virus, it can make you sick too. Okay. Now, these bacteria, these viruses, they're very small. Page 46, we call them microorganism or microbes. They can cause an infection. When they cause infection, when the microbe cause infection, we call it a pathogen. Pathogen is a microbe that can cause an infection. They can cause what we call localized infection. This is an infection that happens in one location of the body. For example, if your patient has urinary tract infection, that's infection in the urinary system. If your patient has pneumonia, that's infection in the lungs, or in the respiratory system. The pathogens, okay, it can be bacteria or virus, okay, it can cause systemic infection. This is infection that affect the entire body. This type of infection, page 46, this type of infection travels through the bloodstream and it's spread throughout the body. It causes symptoms like fever, chills, mental confusion, abnormal blood pressure, etc. Right? Um, at times, the patient will catch an infection while in the healthcare facility. We call it healthcare associated infection. So, nursing assistant, wash your hands often, wear gloves often, okay, when you're providing care. Do not use your gloves more than once or with different patients. Okay, do not enter a resident's room with the gloves that you was using in another patient's room. Okay, do not have your gloves on in the hallway. Okay, so, preventing the spread of infection is important. To understand how to prevent the spread of infection. It is helpful to first understand how it is spread. The chain of infection is usually this a way of describing how infection is transmitted from one human to another. Okay. So page 46, link one, we have the causative agent, the microorganism that is causing the infection. Link two, we have the reservoir where the pathogen lives and multiply. The reservoir can be human, animal, plant, or soil. Okay. Going back to link one, the causative agent can be bacteria, virus, fungi, or parasite. Link three, portal of exit. Any body opening of an infected person that allows pathogen to leave the body, like nose, mouth, eyes, cuts on the skin. Mode of transmission, page 47, it describes how the pathogen will travel. Okay. The main route of transmission are contact, droplet, and airborne transmission. There's direct contact that happens by touching the infected person. Indirect contact basically can happen by touching an object that is contaminated. Link five, you have portal of entry, how the bacteria will enter the body of the new person, of the uninfected person. Okay, the bacteria can enter through your nose, so that's why you don't flop the sheets when you're making the bed. You wear your mask if your patient has any infection like COVID or tuberculosis, right? The bacteria can enter your mouth, your eyes, and other mucous membrane. Mucous membrane are area in the body that is wet, that is moist, like your mouth, your nose, your eyes, your genital areas, your rectum. Link number six, susceptible host. Any uninfected person who could get sick. Okay, the uninfected person can become a susceptible host, especially us healthcare workers. When we are working in healthcare, we are exposed to a lot of things. Patients also are susceptible hosts. They are their immune system is very weak. Okay, so a disease can be um, communicable. It can be contagious. All right. So when it's infectious or when it's contagious, here we're looking at the word transmission on page 47. Passage or transfer of most infectious disease can be blocked by using proper infection prevention practice, such as hand washing. Hand washing is the most important way to stop the spread of infection. All caregivers must wash their hands often. Okay, we practice what we call standard precaution or transmission based precaution. Okay, now let's turn the page and take a look at standard precaution, page 48. Standard precaution means treating blood and other body liquid, page 48. Following standard precaution means treating blood and other body liquids, non-intact skin, like abrasion, as if they are infected. So body fluid can be blood, tears, saliva, sputum, that's mucus that you cough up, right? Urine, feces, etc. Standard precaution must be practiced with every single person that you take care of. Page 48. Okay, transmission-based precaution they vary based on how the infection is transmitted. Okay, now let's talk about the guidelines. Let's look at the guidelines for transmission for standard precaution. The guidelines for standard precaution: wash your hands, wear gloves before everything. Okay, wear gloves before everything. Remove gloves immediately after you are finished with a procedure. Immediately wash all skin surface that have been contaminated. All right. Wear a mask or protective goggles. All right. So again, guys, remember, we're almost done with chapter 2. So hang in there for me, okay? Wear disposable gown, wear a mask and protective goggles when you're working in that kind of environment. So when you come to class on Monday, I will have gown, mask, goggle, gloves. We're gonna practice personal protective equipment. Okay. Never attempt, page 49. Never attempt to recap needles or sharp. Carefully bag all contaminated supplies. Clearly label body fluids. Dispose of contaminated fluid waste according to your facility procedure. Right now, standard precaution, page 49, should be practiced on all your residents. Right now, we call hand washing. Um, we call hand washing the most effective way, the most important thing that the nursing assistant can do to prevent the spread of infection. On page 49, look at the bottom. When should you wash your hands? When you arrive at work, when your hands are visibly soiled, before, between, after contact with your resident, before putting on gloves, after removing gloves, before, after contact with other body fluid. Um, Turn your page. Before and after touching meals, before and after helping with meals, before cleaning, before getting clean linens, after smoking, before eating. So the point is, wash your hands often, wash your hands before and after everything. Okay, so here on page 50, you see the video on hand washing. Remember what I showed you how to wash your hands, and I will also post my own video of hand washing on this channel so that you guys can watch it. Okay, so you point your fingers down. You don't touch the faucet with your bare hand. You use paper towel to turn on the faucet and mix the water. Rinse your hand with your fingers pointing down. Don't shake your hand, right? Now, put soap and scrub front in between the fingers, back of each hand in between the fingers, under your fingernails, your thumb, your wrist, your knuckles. Okay? Now, and when you're finished, you rinse with your fingers pointing down. You use paper towel to dry your hand, and you use paper towel to turn off the faucet. Page 51. Personal protective equipment, we call that PPE. Personal protective equipment. We call them mask, gown, goggle, gloves, right? In some facilities like hospitals, you can have hairnet to cover your hair or even shoe covers. Okay. Now, page 51, don means to put on, doff means to remove. Okay. Now, those of you that are in my class, you already know we have a video on donning gown. Okay, we will do that in the class, but you also have the videos. Please watch that video before your next class. Okay, watch that video, watch this video before coming to class, before we discuss chapter 1 and chapter 2. Okay, so page 52 and 53, you have the way to put on the gown. Okay. Now, again, you face the gown. You tie it around your neck. You tie it around your back like a shoelace. You put your arm through, tie it around the back of your neck, your back. Make sure it covers all your clothes. When you put on your gloves, make sure the cuff of the glove, we're on page 52, by the way, page 52. The cuff of the glove but must cover the cuff of the gown, right? We have videos on that. We're gonna practice that, believe me. Mask, make sure the mask is sealed around your nose and under your chin. Okay. Um, so you must wear your all these personal protective equipments, right? Now, what I want you to, there's a proper way of putting on your gloves, your gown, your mask, your gown, your goggles, all of that. Okay, there's a good proper way and there's the wrong way. Now you need to come to class and watch the video and watch the practice that um to make sure that you practice the right way. When you come to class and I give you time, a chance to practice, use the time wisely, because guess what? Your time with me is limited. There's hundreds more people waiting for me. So use your time with wisely so you can move on to your next level. Okay. Page 54, there's a proper way to remove the gloves. All right. There's a video on that. We're going to spend some time. Pinch the glove in the center, pull it out, close it in one hand with two fingers. Go under the next glove and pull it out. So you avoid touching the area that is soil. Page 54 at the bottom. This is the correct way that the nursing assistant should follow, the correct order that the nurse assistant should follow when donning, putting on PPE. Number one, wash your hands. So take notes, guys, on this one. You're gonna need page 54 on Monday for next class. Number one, wash your hands. Number two, the next thing you do is gown, mask, goggles or face shield, and then gloves. The proper way, the correct order of doffing your PPE. Number one, remove your gloves, then your goggles or face shield, then gown, then mask, and then wash your hands. So donning, it's wash your hands, gown, mask, goggle, gloves. Doffing, gloves, goggles, gown, mask, hand washing. Remember that, okay? Page 55, few more pages left, okay? Um, in a healthcare facility, we handle clean linen, we handle dirty linens. When you're handling clean linens, make sure you wash your hands before you handle clean linens, and you don't let them touch your clothes. So you carry the linen away from your body. Okay. Dirty linen, of course, wash your hands, wear gloves before you remove dirty linens. Guideline, handling linens, handling equipment. Handle all equipment in a way that prevents mucous membrane contact with your clothing, transfers of diseases. Do not reuse equipment again. Dispose of all single use and disposable equipment properly. Disposable means that it is discarded after one use, so you throw it away after one use. Page 55. Clean and disinfect all environmental surface, beds, bed rail, etc., all frequently touched surfaces. Handle, transport, and process soiled linen and clothing in a way that prevent exposure. Okay, bag soiled linen at the point of origin, etc. Right? Page 55. Spills. Spills basically means that something fell on the floor and causes a risk of fall. Okay, it can also cause a risk of infection. All right. So guidelines: cleaning spills, don gloves, right? Put on gloves. Use something to absorb the liquid. Page 56. Scoop up the absorbed spill. Apply the proper disinfectant to the spilled area. Clean up spill immediately. Do not pick up any pieces of broken glass. Waste containing broken glass, blood, or body fluid should be properly bagged. I know some of you are listening to me saying, I don't speak English. He is going too fast. It's okay. When you go back to YouTube, you can reduce the speed and make it go slower. Okay? And watch this video many times. Okay? Page 56, apply proper disinfectant to the spill area. Clean up spill immediately using the proper cleaning solution. Do not pick up any piece of broken glass. That's a no-brainer, right? Okay, let's talk quickly about transmission-based precaution. We got two pages left, and then you get to go to sleep, right? Okay, transmission-based precaution. These precautions are used for people who are infected and may be infected with certain diseases. These precautions are called transmission-based precaution. Okay, page 56, you see airborne precaution. That's because the bacteria is in the air, the disease is in the air. Okay, so the person must clean hand before entering the room. We're reading from the pictures, right? You must wear you must wash your hands, right? For airborne precaution, you got you must wash your hands, wear a mask. If your patient has COVID, you have to wear a special mask we call N95. And then we got to keep the doors closed. All right. Airborne precaution prevent the spread of pathogen that can be transferred through the air. Okay, droplet precautions are used for diseases that are spread by droplets in the air. Let's look at, so it can be caused by cough, right? It gets in the air by sneezes or cough, right? Now, page 57, droplet precaution. Wash your hands before you enter the room. Make sure you wear mask. Anytime you wear mask, you wash your hands. You also have to wear gloves. You have to wear the whole enchilada, gown, goggle, gloves, etc. Right? Next, we're on page 57. We have contact precautions. They are used when the resident may spread an infection by direct contact with a person or object. The infection can be spread by touching a contaminated area of or on the resident's body or her blood or body fluid. Okay, now let's take a quick look at the picture here. We have contact precaution. You must wash your hands, right? Or use hand sanitizer, wear gloves, gown, right? Even mask, why not, right? Just to be on the safe side. So let's look at the word guidelines here on page 57. Okay, when isolation guideline for isolation, when they are indicated, transmission based precaution are always used in addition to standard precaution. So you need to remember that statement because that's the exam question right there. Transmission based precaution are used in addition to standard precaution. So anytime you use transmission based precaution, you also have to use standard precaution. Okay. All right. So you will be told the proper PPEs to wear. Okay. Page 58. Do not share equipment between residents. Wear the proper PPE. Right. When serving food or drink. Follow standard precaution. Okay. Um, all of those are things that you need to keep in mind, right? Contact with infectious diseases. We are on page 58. Bloodborne pathogen are microorganisms found in human blood. Okay. There's another one called so for that one you would need to avoid contact with this body fluid. So you would use contact precaution. Same thing with hepatitis. The inflammation of the liver caused by certain virus or other factors, right? So you would use contact precaution, wash your hands, wear your gloves, right? Um, Tuberculosis, page 50, page 59. Okay, highly contagious. It is caused by a bacterium. Um, it is caused by a bacterium um, that is carried in the mucus droplets suspended in the air. So if you have a patient who has tuberculosis, right? If you have a patient with TB, you need to follow droplet and even airborne precaution. mask, gown, goggle, gloves, wash your hands, and do the right thing, right? Your patient with COVID, remember COVID? All right. COVID is a droplet and airborne disease. It is transmitted through droplets and particles produced when the infected person breathes, sneezes, cough, sings, or talks. Okay? So, signs of COVID, they may appear 3 to 5 days of exposure to the virus, right? We're on page 59. Page 59. Patient may have fatigue, muscle ache, congestion, cough, chills, fever, right? They lost sense of taste or smell. Almost finished. Okay. So there's a guideline. Go to page 60, page 60. 2 more minutes and you get to go home. Don't worry. You get to go back to sleep. You're already home. All right. Guideline for COVID, follow standard precaution. Okay. Monitor patient daily, vital signs, right? Wear proper mask, the N95 mask, of course. Resident who test positive for COVID will be asked to stay in their room. So basically, we have to observe quarantine. We have to quarantine. We have to observe isolation. Airborne precaution in the isolation room. All right. Do not share any personal item. Wash your hands. Okay. Wear all your PPEs. Encourage your patient to rest and drink plenty of fluid. After you provide care, wash your hands and make sure you don't touch your eyes, your nose, your mouth. Because if your hands are contaminated, you touch your eyes, your nose, and your mouth, you're basically causing yourself to become contaminated. And if you have the virus, if you feel sick, do not go to work. Any CNAs that goes to work, any nurse that goes to work while they're sick, they are a problem to the patient because if your patient catch your sickness, they may die. You can survive anything. A CNA can be very strong, right? But your patient can be very weak. All right? Your patient can be very weak. Okay, so this is it. Somebody just says, my God, this is too much, right? What did you think you signed up for? But I'm sorry, it's just the way it is. This is healthcare. Okay? Giving patient care is not an easy thing, so you need to take some time to learn the material. And believe me, you're not gonna get it all at once. So chapter 1 and chapter 2 are recorded. So basically take some time to review it. If anybody misses this chapter, please go back on YouTube because as you can see, I'm not doing this 2 hour teaching again. So everybody can go back because we got to do chapter 3 soon. Thank you guys for coming out. When you come back to class on Monday, we will cover question on chapter 2 and 3, on chapter 1 and 2, and then we will do our exam and do more labs in the classrooms. Okay, so it's a pleasure being with you tonight. Let me see if you guys have any questions. Anybody has questions? I see somebody with their hands up. Anybody with a question, unmute yourself. And then, okay, no questions. I guess the only question is, can I go back to sleep? Right? It's all right. It's a lot of information and it's late at night. I want to thank you guys for coming out. I really appreciate you coming in. Adeline, Noel, all the people that I can see. Inez Nivos is here. Adeline Noel is here. Who else is here? Oh my goodness. Somebody with baby phone is here. I mean, Termelus. I'm going to give everybody credit for being here. Beatrice, I'm happy you're here. Who else? Adeline Noel, Belon Louis is here. Benita, Bernadette, somebody named Bivi. I don't know who that is, right? And right? Somebody's on the camera, on the video. I'm happy to say, oh, that's Neve Woods. Aminta Milus, Belon. Who else is here? Camilla, Carla, Carlene, Caroline, Katie, Katsi, Shakia, Carla, everybody. I mean, that's 100 people, man. Wow. I am so happy you guys were on. Jada was here. Hey, Jada. Uh, Ismidaville is here. Katie's here. So, again, thank you for joining us, and I'll see you guys soon. Don't forget your ESL class and your review on Saturday. Okay, guys? Take care and review this video. If you don't have any questions, I will end this live feed. Okay, guys? Thank you so much. Let me end
Good
my
night,
stream.
teacher.
Good night, my friend. Thank you for joining us. I know it's late. You are quite welcome. You are quite welcome. Please review the video. Okay?
Thank you. Good night.
Good night. Good night. You guys are welcome. Bye bye. Don't forget Saturday. You're welcome. You're welcome. Good night. Oh wow! Look at some beautiful people on on the Zoom. Wow. You guys are more beautiful on Zoom than you are in the classroom. Oh wow. All right. Look at this. Let me turn this so my let's see here. Take a look here. Uh-oh. Night night. All right. Uh-oh. Good night. Good night, guys. Oh,
Teacher.
yes.
Yeah, teacher.
All right. Schneider, good to have you on the line, on the Zoom.
Yeah.
Junior Shea Style is here. Wow, good looking people. All right, guys. You guys have a great night, okay? Okay, bye-bye.